Questions? The member from London, Fanshawe.
Could answer this question, and I just want to go back a little bit. When the Liberal Party was in charge of the government back in the majority days, Premier Kathleen Wynne's government is trying to extricate itself from one privatization disaster, even if it sets itself up for another, and that's the orange one that they're referring to. The current disaster of its handling of surgical clinics. Ontarians may recall that the government's decision to expand the scope of private clinics, announced with much fanfare by then Health Minister Deb Matthews in 2012. So I just need to ask the members a question. Do they support privatization and healthcare expansion or not?
Response.
Stand categorically against Bill 60 and the way in which it gives way to corporatized profiteering in our healthcare system. There is absolutely no room for that. We have been clear. I campaigned as a Liberal in the last election, saying that there is room to move some surgeries out of hospitals in a not-for-profit model with adequate guardrails. That remains our position. And to be clear, we are entirely against the profiteering and corporatization being proposed under this legislation.
Questions? The member from Etobicoke Lakeshore.
Well, thank you very much, Madam Speaker, and I find it interesting hearing the Liberals, but I guess when the Liberals were in power, they didn't have to worry about health care because they were just driving 300,000 families and businesses out of the province, so they didn't think we had people because there really wasn't any jobs for them. So, you know, they just assumed there would not be any people, so we wouldn't have to fix health care. But health care does need to be fixed, and this government is the government that is fixing health care by looking outside the box and making sure this happens. So my question to the members opposite is, we launched the largest health care recruiting initiative in Ontario's history. Will the member opposite support the future of our publicly funded health care system by supporting this bill?
Response?
Sure. Okay. What an incredibly peculiar question. I am absolutely an advocate for public health care. Public health care that complies with the 5, not 4 principles of Medicare. But I will stand firmly against any efforts that encroach or undermine the merits of that publicly funded healthcare system. So anything that moves towards corporatization and specifically profiteering, in very much the same way that we saw under this government, the further corporatization and profiteering in long-term care homes, which led to consistently inferior health outcomes, and to which this government had no response except to award more contracts and to do nothing to defend those patients.
Question. Member from Niagara Falls.
Thank you again, Madam Speaker. My question is to the doctor. He said the Ontario Hospital Association has said very clearly to this government 124 shouldn't be extended. I think that's pretty clear. What I've never understood is why we have a Labour minister on that side of the House that is supposed to be nonpartisan is supporting and continues to support Bill 124. I hope he hears me. I don't know if he can hear me or not, but I hope he does. And you also said that performance is better not-for-profit than compared to profit. And then when I take a look at my long-term care, because I'm the critic, 5,400 people died in long-term care. About approximately 3,800 of them died in private long-term care. So my question to you, do you agree that everything should stay for not-for-profit?
Response?
Thank you very much for that question. I absolutely agree that the solutions to our healthcare system lie in the not-for-profit sector. And we've seen the corrupting effects of profiteering in our healthcare system. We've seen how Bill 124, for example, has pushed nurses out of public healthcare, and things like temporary for-profit nursing agencies, which have proliferated under this government, have subsequently pulled nurses out of public healthcare. It's why, in my unwavering commitment to protect our public health care system, I introduce legislation next week that will hold these nursing agencies to account, that will commit and strengthen our publicly funded health care system. It's what I have done as a physician. It is what I am doing as an opposition critic, and it is what I and the rest of the Liberal caucus will always do. Thank you.
Questions? Member from Whitby.
Thank you, Speaker, and to the member from Don Valley East. Interesting presentation, isn't it? 15 years, they did absolutely nothing. Absolutely nothing. One of the aspects of our plan, Speaker, supports expanding the number of physicians that can join a family health team. I'm from a region that has 1 million people. People that I represent, 149,000 people. This is something they want. This is something I hear at the doors that I knock every weekend, every other weekend. Can the member from Don Valley East tell me whether he supports increasing access
Question.
to family health teams? Thank you, Speaker.
Response.
I absolutely support the principle of increasing access to team-based primary care. And I'm still waiting for a solution that will deliver that in this province, because Bill 60 certainly won't. It's simply window dressing. So, when the member across is ready to present a proposal that will credibly deliver that, I'll be here and I'll be ready to listen. The member across also, made the allegation that nothing happened over the last 15 years of Liberal, the previous 15 years of Liberal government. I would point out that the most immediate 5 years of performance under this Conservative government have been the worst years in this province's entire history. So, I would caution the member about any sort of chest thumping, given the current state of our healthcare system.
Questions? The member from Hamilton West, Ancaster, Dundas.
Thank you very much, Speaker. I would like to pick up on your information that I thought was very interesting about how the director is being appointed and why that difference is there. And I would refer back to the Auditor General's value for money audit. And I'm going to quote from that report where they said, she said, "We found that some patients could be given misleading information as part of sales practices to make a profit. Several of our findings, such as the underuse of hospital operating rooms and the lack of ministry oversight, have been noted in our past value for money audits." So the Auditor General has identified the lack of oversight, has identified that profiteering is a problem, and so I would give you an opportunity to comment on, we haven't even addressed the Auditor General's recommendations, and now they're doubling down on the lack of oversight and profiteering.
Thank you. Response.
Thank you for that very astute observation. And it's a point, actually, that we've heard a few times in the chamber during question period and during past debates. And on repeated occasions, the Minister of Health has been very clear that she didn't believe that there was a problem in the first place. And I recall quite vividly that she's cited a 1-800 number, I believe, to anyone that believes that they've been upsold and upcharged. In frank contradiction to what the Auditor General has been telling us. And so amidst that backdrop, amidst this problem that we know is objectively a problem, this government now expects us to believe that coming out of that fantasy land, they can be trusted to protect against upcharging and upselling with this new fallacy of a plan. It simply is not credible. Thank you for your question.
Quick question. The member from Brampton East, up north.
Thank you, Madam Speaker, and I appreciate, I guess, the revised history lesson from our new Liberal colleagues. I can appreciate that they weren't elected during the 15 years where Liberal governments fired nurses, closed down hospitals, including the Peel Memorial Hospital, which is actually the hospital I was born in, and Brampton, and actually. I guess the other previous Liberal members in the previous government who also voted against rebuilding that hospital in Brampton to get a second hospital at the site of Peel Memorial. So I can appreciate that these members might, and I look forward to their support on other measures that we're doing for Brampton. I guess when we talk about corporate profiteering and privatization, 13 comments.
Response. Quick response.
Thank you. I always enjoy hearing from my colleague in Brampton North. Funny to hear him talk about closures. Under this government, we've seen closures of emergency departments, intensive care units, obstetrical units, walk-in clinics, everything. So it's dramatically hypocritical for him to be talking about closures of any sort, considering his government has resulted in more closures than any other government in history.
Thank you.